millions of youth, can bring in into the lives of the millions, as also aiming to make Andhra Pradesh Swarna Andhra Pradesh by 2047. The vision of the state and the country is defined by the two great leaders who have courage to dream, commitment for delivery, and compassion for the poor. Under their leadership, I am pretty confident that India will become a Vikasit Bharat by being one of top two economies, largest economies of the world, and also Andhra Pradesh, a Swarna Andhra Pradesh. But when I say so, the health to attain this, to achieve this by 2047, health assumes significance because accessible, affordable health care will create healthy people. Healthy people in turn will add to the economic growth or wealth creation. So, in this context, we have many challenges in Andhra Pradesh, like even in the country, as we are still a developing nation, where many gaps, demographical, many diverse challenges. During these challenges, it is important to leverage technology to find solution to face these challenges and bring in a transformative change in the health sector. I am pretty confident because the achievements of the health ministry and what the state and health ministry more particularly is affecting for this conclave will be presented by our Special Chief Secretary Krishna Babu Garu. But I want to say one thing. We have a huge data captured by our healthcare professionals, right from the ANM, ASHA workers to ANMs to CHOs to healthcare professionals in the teaching hospitals, collected from 10,000 plus wellness centers at the village level and 1,700 plus primary health centers at rural and urban areas, and more than 250, close to 250 community health centers, area hospitals, district hospitals and teaching hospitals. But how do we integrate this data with the technology and bring in a betterment in the lives of the people and healthcare sector in particular? That's where deep tech solutions come into the picture. These solutions must provide predictive analytics, because my Honorable CM keeps talking about all the time about the new technologies, blockchain, data analytics, artificial intelligence solutions. These solutions should bring predictive analytics and therefore allowing us to take precautionary preventive measures and save the lives, and more particularly reduce the out-of-pocket expenditure of a common man or a patient, and also burden on the state exchequer or the nation's exchequer. So I urge upon the youth of the Andhra Pradesh, because Andhra Pradesh is known for intellect. There are lakhs of people, because of Chandrababu Naidu Garu, have migrated to America, and they are proving that mettle. So I urge upon all of them to focus more on this deep tech solutions and help the Andhra Pradesh health sector. And I know, you all know, the leader like Chandrababu Naidu Garu being at the helm of affairs, the investors or innovators will get every possible support in the state. I take this opportunity to urge upon, appeal Honorable CM, sir, form a committee particularly on that, and you have been bringing many policies in every sector. And also I appeal you, sir, to bring in a policy for deep tech innovations in Andhra Pradesh, so that more and more youth comes forward and they will be instrumental in building the Andhra Pradesh, Swarna Andhra Pradesh by 2047. So I take this opportunity to thank the organizers for giving me this opportunity of meeting of all, and more particularly to learn many things. I am not a doctor, I am a health minister. I have been a health minister for the past 6 months. I have always been a political student or an engineering student. I never knew anything about the medicine. Nothing, and not even a technology. But still, Honorable Prime Minister, Honorable Chief Minister of Andhra Pradesh have given me this opportunity to know many things and be an instrument in bringing a change in the lives of the people of Andhra Pradesh. Thank you all.
Thank you, Honorable Minister. Now I have the pleasure of inviting Shri Krishna Babu Garu to deliver his keynote address.
Yeah, a presentation. Good afternoon, Honorable Chief Minister of Andhra Pradesh, Nara Chandrababu Naidu Garu, GFST Takkar Saab, Honorable Ministers, MLAs, MLCs, and all the other distinguished guests. So, I just wanted to just present about what this Andhra Pradesh Public Health 2. Why we are talking about 2 is the way in which Honorable Chief Minister wants us to think, act, using the digital technology, using artificial intelligence, machine learning, and deep tech to take preventive action rather than concentrating on curative thing. Curative is always important, but coming back to preventive gives much better result. Our Swarnandhra tagline is towards wealthy, healthy, happy Andhra Pradesh. So by 2047, that is the kind of society Honorable Chief Minister wants to do. So this is, we are going towards that. Just I will present what exactly, where we stand today, what are the challenges being faced, and what we wanted to, all the invitees, GFST, I thank especially Takkar Saab and the entire team, to make available this much talent pool available to health department to think, to interact, and also to collaborate, developing a system wherein we can make this goal, happy and healthy Andhra Pradesh, a reality. So demographically, Honorable Chief Minister always talks about demographic management. That slide is gone. Just can you go back? So the main challenge is fertility rate is presently 1.54 and it is going to drop to 1.37 by 2047. So this has a serious implication about the dependency ratio may be the same, but the child, that is 0 to 14 years population, there will be almost 7% decrease, and 60 plus years population is around almost means from 14% to 23%, 9% increase. So this will be posing a real challenge in the economic development, because the working age population is going to reduce. This has its own implications. That is why how to ensure that the fertility rate increases and also the dependency ratio comes down by creating a workable solution to the 60 plus age group population. We have overall, if you see Andhra Pradesh, we are having better indicators about access of the people to the health facility. Whether it is the village health centers, public PHCs, primary health centers, or area hospitals, beds for 1,000 population, except the CHC, coverage of community health centers, we are above the national norms, IPHS norms, and human resources also, Andhra Pradesh is fortunate to have very positive human resources. as per the WHO norms, whatever is required, we are much above that. Whether it is the doctors, including specialists, is 1.5 per 1,000 population, nurses around 3.8 per 1,000 population compared to 3, and 50 overall total population for physicians, nurses and midwives for 10,000 population, almost 50.9 compared to WHO standards of 44.5. This is a very positive way where we have good human talent pool, especially in the health sector. We just jotted down the Swarnandhra goals and SDG goals. SDG goals we have to achieve by 2030. Honorable Chief Minister always directs us to plan such that we reach the goals much before it. We are doing reasonably well. Almost 4 indicators out of 8, we are already close to achieving the SDG goals, and balance 4, it is under 5 wasted, then adolescent girls, anemia, tuberculosis incident rate, and also life expectancy. These are slightly difficult to achieve as on today, but next we have 5 years time. Definitely we'll try our best to see that they are achieved. But Swarnandhra goal, aligned with Viksit Bharat, is a very tough call. So all have to change the way we plan everything, and then ensure that we reach there much early. The percentage of out-of-pocket expenditure, now it is as per NFHS 5 survey, it is almost 63.6%. The toughest goal is this, bringing it to less than 5% by ensuring that health insurance for all is made effectively implemented. See, similarly, we have almost 80% of the population covers under the NTR Vaidya Seva. So we have to make it 100%, and also we have to streamline. The government has already made a promise in the manifesto, the health insurance for all. Geriatric care facilities, presently we have in district hospitals, subdivisional hospitals and CHCs. Now it is the goal is to ensure that all the healthcare facilities up to the village health clinics have the geriatric facilities. NABH, NAQS, basically quality indicators. As of now, 7% of the institutions are given certification. So our target is at least next 2 years, we should at least reach 80%. We are working on that. Key initiatives, what we are doing is, we have to make a health profile of the entire population. So Abha ID is one of the key indicator where if now as on today around 4.19 crore individuals we are able to do the Abha ID, and which reflects to 80% of the population. Then when we do the survey, now NCD 3 survey is going on. We are doing universal health survey, wherein all the NCDs are being recorded, including the cancer care. So cancer, the preliminary screening for breast, cervical and oral cancer. Then all these suspected cases found out by the health level worker, village level health workers, CHO, ANM and ASHA workers, they will be confirmed by the medical officer. After confirming, they will put on the treatment. Then continuity of care is ensured by almost line listing of the data is available to ensure that all are covered. Almost now the continuum of care is around 80%. Just we have to make it almost 100%, and also Abha ID creation, now it is around 80%. We have to ensure that goes to 100% in this screening. Then maternal child health care is another very important area. Almost 69 lakh children, especially 6 months to 6 years, and also school going children, we are having the health screening going on now. Then whoever is registered in RCH portal, pregnant women, they are tracking of them, seeing high risk pregnancies and tracking and seeing that they get proper care such that the maternal mortality, infant mortality is reduced to substantially minimum. So we are doing anemia monitoring almost monthly basis for the pregnant women and quarterly basis for adolescent girls. And also follow-up is being done both at PHCS, CHC level and also referral services by iron sucrose injections and blood transfusion, and if that is not responding, then other referral mechanism. We have a strong EHR. Now we are doing almost all the hospitals from PHC to tertiary hospitals. We are putting integrated electronic health records. So this is centralized repository of the patient information, and this will be having continuity of tracking of the individual from primary health, from the preventive care aspect, from the primary health side till tertiary care. And we have integrated the primary health to tertiary care such that the people who are identified with certain problem, whether that referral is happening properly or not. So almost now we can proudly say we are the almost leaders in India to have almost 5.5 crore health records which are linked with EHR, electronic health record, and 19,700 health facilities are in the EHR. We have created Aabhas. Then health around 58,900 professionals are also done. Then unified data platform. So all the departments, ultimately the result will be when all the departmental database talks to each other, and we plan according to that and means see whether the outcomes are coming or not. So we have developed a system wherein health, women and child welfare, school education, panchayati raj, municipal administration, all the databases are integrated with taking this API, and nutrition and anemia status of pregnant and adolescent girls, as well as health monitoring, high risk pregnancy of the women, and also other side sanitation, vector control measures, water quality testing. All these are integrated such that the information with one department is available for all other departments to see and act. So, and also monitoring can be done at the senior level. Another thing what we are doing is existing whatever items are there, for monitoring of that we are using technology, biomedical equipment, almost 1.33 lakh equipments are there, which are put on the system, and we know the exact status of how many are working, how many complaints are raised, how many are getting resolved, etc. Teleradiology services, similarly CKD and dialysis patient treatment, telemedicine consultation. Almost Andhra Pradesh is having almost 21% of India's total teleconsultations as of now. Almost average calls is 65,000 per day. So this is how we are able to make available the specialist services from the hub, from the specialist to the lowermost health system, that is village health clinics. Then with facial recognition, almost we have started using 106,000 employees of health department. Each employee they have to register in the face recognition system, and they have to make attendance 3 times. Morning 9 o'clock, 2 o'clock and 4 o'clock. So by that, at least the compared to earlier time where only 60 to 65% attendance used to be there, almost when we started deducting the leaves etc. based on FRS attendance, now almost it is more than 92-93%, and sometimes it is reaching 98% if including leaves etc. Sanitation, security, pest control also, Honorable Chief Minister directed that the artificial intelligence machine learning should be used to real-time monitor what is happening, what is the quality, rather than just depending on the report or feedback from the superintendent. So that is what is being done. What are the key challenges? Now most of the data is in silos, so naturally main integration, data fragmentation, so integration has to be there. So that we are trying. This is where we wanted to understand what best can be done in the shortest possible time to have visibility. Similarly, lack of outcome focused dashboards. So we have data for each of the items, but only thing is overall when we just review we are lacking the kind of dashboards which will give real-time database. Similarly, data governance and also limited capacity of the employees to use the data and also build up concrete quality data. So then what is that we just wanted to have? That is, we want to develop a digital twin. Each of the person should have a digital image of him with the government, such that at least each person from the starting birth to death, he can be tracked and analysis can be done. So that is with the advanced diagnostics. Then of course data privacy, as many of the speakers have told, that is the biggest challenge. So because this data should be available for understanding the geographical prevalence and also disease pattern and identifying the root causes for the diseases such that we can take preventive action. So this is how the entire NCD survey data need to be used. Then we also want to introduce AI assisted chronic disease prediction and taking preventive action to ensure that these kind of things at least will get controlled in the future. Similarly, genetic testing, as we know, even though it is expensive as on today, Honorable Chief Minister talks about genetic testing as a tool, because once the scale comes, the value, the treatment cost also will come down. So then at least personalized medicine protocols can be developed such that each person can be targeted for improving the health. Similarly, tech-enabled preventive care management and also to create total data lake from entire databases available in the health sector and also the related departments to ensure that we have actionable dashboards with proper information such that we can do much better in this area. So what we can offer to the people who wants to work with us, we have huge data. At least the masked data can be given wherein our Thakkar Sahib has told sandbox. So the masked data can be given for analysis, because this much data, I don't think the people will not get, any startup company will not get in the entire country. So that data we can provide such that you can use it, you can build models, and also you can say use case scenarios or pilots you can do, proof of concepts you can do, such that at least it will be a win-win exercise for both the developer as well as the government. So this can be done through virtual PMU. We are having now virtual PMU. We have tied up with our MOU partner with Swasti Group, and also we are trying to onboard many people of Andhra origin who are doing excellent work in IT, in healthcare sector, elsewhere, such that virtual PMU can be made, and also they can screen the projects proposals which are coming, which will be reliant to Andhra Pradesh. Similarly, data and AI center in the policy and practices also we need help for the people who are having expertise in this. And also we also want to put medtech center of excellence, because many diagnostic equipments are coming, many systems are getting developed. We also want it to be screened by professionals such that the right kind of thing which will be useful to the AP can be used. So this is what we can offer. So any company, startup, or the use case scenarios, you are welcome to just come to us, collaborate with us. We are ready to offer whatever assistance is required for doing quality pilots. Thank you very much.
For the logistic issues, we are moving this podium to the ground because now we have more speakers. We don't want any blind spots on the dais. Now what we are going to do is, we have an extensive health tech panel. Already since we are overshot the time, I will be inviting the moderator. So she will invite the rest of the panelists, and then I request the moderator and the panelists to stick to time, because Honorable CM Sir expressed his intention to have an interactive session immediately after the health tech. He wants to interact with all the delegates in the hall. No. So that is for your information. So please wait for the next 1 hour so that we will have a very interactive session with Honorable CM. So now it is my pleasure to invite Dr. Angela Chaudhary, who is the Chief Executive Officer of Swasti. Can you come over and invite other panelists and conduct the panel discussion, please?
Thank you for the privilege of, I am too short for this actually, I'm going to tiptoe. Thank you for the privilege of being here, a very warm welcome. I'm going to be a bit loud because it's a post-lunch session and I can see some people snoozing. Feel free to stand up and stretch yourself if you like. I think that's good for you and good for the blood circulation. But before I start, maybe we could start with a resounding round of applause just to wake us all up and energy. Because why? Because health is wealth. Is health wealth? Yes? So can I get a louder applause? All right, I do see half the room waking up, so that's great. A warm welcome to all dignitaries, Honorable Chief Minister Chandrababu Naidu and Minister of Health Satyakumar Yadav. My name is Dr. Angela Chaudhary and I'm the Chief Catalyst of Swasti. It's an Indian-born global public health organization that tirelessly works for vulnerable communities to bring 100 million healthy days by 2030. And since I have this stage, I'm going to take 2 seconds extra to say, sir, when I was a dental intern, I was part of your Janmabhoomi program from a large group of dental colleges in Bangalore that were very excited to come to the neighboring state and support districts like Andhra Pradesh, Chittoor, Tirumala and Tirupati. And I must say I was the only non-Telugu speaking person, but at the end of 2 weeks I did learn dental language in Telugu, so just a aside. But I want to say that AI and deep tech, like Krishna Babu Garu just mentioned, focuses on population health management and disease prevention. From the morning we've been talking about diagnostics and R&D, which are very important, very less talked about in the public health and surveillance scenario, like population health pattern analysis. If we didn't know where the population was going, tomorrow we might end up with non-economically productive populations. So we have to have those analytics. Environmental health monitoring. Do we know when is the next extreme weather event? Human resource allocation. We all saw what happened during the COVID response. We didn't know how to quickly multitask and quickly deploy good human health workforce to space. And health equity analysis, most important and dear to me. Who are the people left out of the health systems? Who's not getting the services that they need to get? And of course, contact tracing and health communications. These kinds of technologies using AI and deep tech help us make good governing, good health decisions that implement preventive measures across the community, leaving no one behind. They are particularly valuable to prevent pandemics, to address health disparities and improve population-wide outcome. The key risks, so I have the pleasure of inviting a very good panel, but let me not postpone that. Very quickly before we get on to that, Andhra Pradesh is special. We have coastal vulnerabilities here. This is a key subject. While I work, in my organization, working with farmers, fishers, women and garment workers, etc., they are faced by barrage of environmental risks, and they are only increasing in frequency and in extremities. Andhra Pradesh is not, it's special that way. You have a large coastal region. Coastal erosions are affecting fishing communities. The saltwater intrusion into agricultural land, people depend on them for livelihoods, and we depend on that for food. We have heat waves, we have dry spell, we have droughts, and there's massive agricultural impacts and weather security issues. So before I start the panel, we have a short presentation on what climate resilience and deep tech and AI applications into climate resilience. May I invite Dr. Dinesh Arora from ADB to present the financing on climate and health. Thank you.
Thank you, Angela, and thank you, Honorable Chief Minister, and thank you for a wonderful presentation, the principals, the Additional Chief Secretary from Andhra Pradesh. I just wanted to sensitize on an issue which is rarely discussed. Pakistan suffered floods in 2022. 15% of its primary health centers got destroyed. About 4 times snake bites increased because of the flooding in that area. But the public health centers were not ready for this. Why did they collapse? Because they were not resilient enough. Bangladesh is having dengue across the year. It used to be only seasonal, 2 months. But now because of the rainfall patterns, increase in climate change and heat, the mosquito breeding has increased. New viruses are coming. If our glaciers melt, 50% new organisms from the permafrost will come, and we are not sure how we deal with them. This is one, Honorable Chief Minister, I wanted to sensitize on one issue of climate and health which is coming up. And many naysayers in the past have become yes-sayers for this. And Andhra Pradesh is no exception to that. We have floods, we have perceived temperatures, like in Visakhapatnam, because of humidity, it could go beyond 50. Informal workers, mainly ladies who work in the farms, how do we help them mitigate this loss? Animal health, the bird flu is so common, Nipah viruses. In fact, 5 of the 6 pandemics have come from animal origin. When we talk about health, animal health should be part of it. Unfortunately, we always talk about human health, leaving out animal health, which has been responsible for most of the crises, including COVID-19. 5 principles G20 India adopted this year, last year when they were there. And I just wanted to take you through those 5 principles. The first principle is resilient healthcare. Can our health structure stand when earthquake, floods, or any damage happens, or cyclone happens? That's called resistant. And if any damage happens, they become responsive and come back normally. That's resilient infrastructure. We do it for many things, but do it for health services, not only for infrastructure, but even for our health workforce has to be climate resilient. So I will showcase 2 tools. One is patch, which is being used in Philippines, and I'm glad that today Andhra Pradesh is signing MOU for that tool to use. How do you maximize resources when such cyclones can be predicted? And second, on urban health tool, heat tool. Can we predict heat waves and how do we mitigate with them? The second principle is building low carbon health systems to decrease carbon temperatures. Electrification through renewable energy, electrification of ambulances, use of LED light bulbs, or very simple ways. Similarly, decarbonized health centers. Can Andhra Pradesh lead India in doing a decarbonization mapping of its health services like NHS has done? Sir, NHS is targeting NHS hospitals net zero by 2040. Can Andhra take that lead? And we are here to support and work with you on that. Green supply chain, whether it is vaccines, therapeutics, diagnostics, the packaging, can the material be used so that it has less carboniferous? Climate financing. In fact, sir, why I am talking here, because in the name of climate for health, we will get a lot of grant financing. So even if the loans come from World Bank or ADB, interest rates can buy down with this, and it can be actually at 0 interest rates. One very interesting is health insurance. Sir, you are the pioneer of the scheme which has been across India now. I was the Deputy CEO of Ayushman Bharat, the PMJY scheme. Sir, we have today 5-star ratings of AC air conditions, that how much energy they save. Can we have 5-star rating for, if I am using a knee replacement, how much carbon it has taken? Can we move towards incentivizing low carboniferous productions? It is possible. US and Korea are contemplating, can Andhra take the lead and come up with a incentivization mechanism for knee replacement, hip replacement to be less carboniferous? And of course, let's have animal health, not forget animal health should be part of human health when we discuss health pandemic preparedness. Sir, this is the patch tool. Sir, I'm glad today you are signing MOU with them. With this, we map climate data with health data and actually can predict that what cycles are coming. And this was done in a study in Philippines, in one of the counties, and we could predict that when damage is coming, are the kits ready? Are the health workers trained enough? Is there a backup for the vaccines, for the medicines to be stored? Simple thing, when floods happen, do we have 3-story building where we can store ORS so that rehydration can be given when the floods are hit? This has been very successful in Philippines, and I'm glad Andhra is taking that lead today. Similarly, this is a tool of using AI with mapping from climate data to come up with heat maps. 60 meter square heat maps can be generated, and then we can predict in these hours there should be limited activity on those days. We are also coming with a parametric insurance. If there are 3 regular days of heat, women who work in the field will be compensated through an insurance scheme which is being done through SEVA right now by Swiss Re in a pilot way, but it is being taken globally. Couple of these things where we would like to highlight and come and work with your team here to get them a parametric insurance for heat stresses. This is the 60 hexagonal, sir. So the climate is not only temperature, it's humidity. It's also the base structure of anthropogenic surface area, greenery, water bodies which can be mapped, and then we can predict what are the urban islands which we need to protect against heat stresses. Finally, one of the best practices I wanted to highlight is Center for Disease Control. Normally it has been done only for vector-borne diseases, but today concept is changing. It's for non-communicable diseases, it's for communicable, and it's also for animal health. The Asian CDC which ADB is supporting is now the latest one where we talk about one health workforce, which is human health, veterinary doctors and the paramedics all coming together, which not only bring the solutions but also do the economic researches. So I think we can have one CDC established in Andhra Pradesh which can actually lead the way and could then become a regional CDC for many other states and in fact for the other countries also. I think I'll pause here for the time. Thank you. One last slide, sir. Climate vulnerable diseases like dengue, chikungunya, TB, these are becoming. So there is a huge catalytic grant capital available from Gates, Temasek, Tahir, Tata Trust. I think Madhav is here. Green Climate Fund. We can channelize that grant financing so that we can have meaningful impact on how do we decrease climate vulnerable diseases, come up with the newer vaccines for dengue. Why should it take 60 years to come for a vaccine for TB when it took 9 months for COVID? Because it's in the third world. But can we use this grant financing along with the multilateral financing from ADB World Bank to channelize resources and end TB, malaria in Andhra Pradesh, in India? One last snippet, sir. The specificity of tuberculin test is only 50%. World over, we have moved towards TruGen, X-Gene Expert, AI-based X-rays, but still 50% in India are still being used for specificity, which has only 50%, the clinic diagnostics. Can we move to neo-diagnosis for TB, which can eliminate that? That's my last appeal, sir. And the telemedicine is not only increasing access, as I think the Principal Secretary showed a wonderful presentation, they're talking about smart health ATMs. In fact, it is also less carboniferous and it decreases huge less when traveling expenditure is not there, people are not going, they get medicine with one pair. Telemedicine, in fact, should be the aim we move forward. And when the Principal Secretary did mention about the futuristic IT tech, sir, I have just one request. Imagine at 2 a.m. in the night, a pregnant mother is having palpitations. What should she do? Can we have a system which sir mentioned? She calls up a call center. They recognize the mobile. They have a Abha ID. They say, hey, what is your happening? Suddenly the triage goes to a nurse. She explains, okay, can you have your BP? Can you take your lime water? Are you able to do? They send an ambulance at home at 2 a.m. in the night. The concerned nearest hospital is informed that a pregnant mother with palpitations is coming. She goes there. If everything is fine, she returns back. There's a continuum of care. Next day morning, a specialist is arranged where at 11 o'clock her appointment is fixed. She goes there, gets medicines and comes back. That is perhaps Swaran Andhra in patient-centric terms, which I think the team is trying and we are here to support that. Thank you.
Thank you, Dr. Dinesh, for highlighting the connections between climate and health, and more so highlighting the interest-free financing that's available for climate and health initiatives. May I now call upon my panelists. We are very fortunate to have some of the brightest minds that I have worked with in this space, and so we'll all have the privilege of hearing them as well. In quick succession, Mr. Madhav Joshi, CEO of the India Health Fund, Dr. Reddy, Clinical Director, Rainbow Hospitals, Dr. Sanjay Saran, CEO, IKP Knowledge Park, Dr. Rora is already here, Mr. Amit Nagraj, Senior Health Specialist from the World Bank, Dr. Sanjay Patan Shetty, Director, School of Public Health, NIMS University, yes, and Dr. Srinivas Muduri, Department Head, University of Basel. Could you please take the stage? Thank you. Srinivas Khosla, Dr. Srinivas Khosla. I will start. Okay, thank you for being here. This panel is essentially about how can AI and deep tech help us all achieve the goals of Swarna Andhra Vision 2047. And because this is a very large panel, I'm going to stand so I can see all your faces. I'm going to start with you, Dr. Srinivas. The first one, Dr. Srinivas, you have two, okay, for all of you, we have two Dr. Srinivases and two Dr. Sanjays. So this is going to be a fun panel. The first Dr. Srinivas in the green. My question to you is, how do you, please introduce yourself in short, and how do you think AI and deep tech can help Andhra Pradesh reach its
Thank you
goal?
very much for giving this opportunity, respected CM, Mr. Chandrababu Naidu Garu and other dignitaries. Yeah, AI is definitely the major tool that's going to play a role in healthcare. But the main thing, we need to use the AI, especially in a program called REACH. It should be very effective in the rural, effective, comprehensive healthcare. Now, this has to play a role based on the sustainable healthcare, a consistentable healthcare, a deliverable healthcare, and most important, in a transparency way. Now, how it works exactly is, it should create a blended financing model where the patient needs to be looked upon as a deliverability for care in a possible way where there is no finances involved. For that, we always recommend a model called no cost, low cost, high cost. It's a different levels of organizational aspect based upon the schemes that are available from the government, which should be very much delivered. Now, for that, we need to be able to identify an issue. It could be a micro issue or a macro issue. Now, taking a micro issue, it could be a single focused agenda of a disorder. For an example, we, coming from Hyderabad, the GSR hospital, we deal with a specialized aspect called the Center of Excellency for Craniofacial Anomalies. For the last 30 years, we have delivered care for the state of Andhra Pradesh for more than 40,000 patients. We started this way back in 2001, where we used the Janmabhoomi project, and at that time we had a wonderful secretary, Mr. Parida, where he could identify in the census the incidence of these facial deformities where the children are born without nose, without eyes, without ears, without lips, or some sort of deformity. Then we had an incidence. Now, this was in 2001. But now, if we exploited that same incidence, we have it more than in 5 folds. Now, what exactly we can do is, using this incidence, now going back to reaching to the care at the primary level. Now, using the AI, we already come up to what you call as the predictional outcomes. We have subclassified all these disorders. We know what is the treatment methods that we have to use. And next thing is, by using this model, we can identify the outcome measurement. So the basic problem of the patient is the feel of shame and the fear of scare to go to the hospital. So if you could explain to them, so they go onto the app, which is available with the Anganwadi worker, which go to the house to house, where they see a child with a defect, where they just scan it, and then they get the picture and they put it into the app, and then it automatically tells you what sort of the defect it is about. Now this defect, how the treatment is done, what is the length of procedure of treatment done, where all it can done, and then the outcome out. So that gives a confidence to the patient to go forward. This is how the AI can be used at different levels in the healthcare system.
Thank you, Dr. Srinivas. So you talk about last mile reach, last mile app, and a low cost, high cost blended financing model.
It's called the
Thank
blended
you.
convergence model.
If you could please pass the mic on to the next Dr. Srinivas. Dr. Srinivas, given all your high and deep work in Andhra Pradesh and the fact that you're from the academia, could you highlight how AI and deep tech can actually be leveraged, particularly in your line of work and what you'd like to do here?
Right. Thank you, Angela, for having me here. Honorable Chief Minister, Thakkar sir, thank you very much for having me here. I came from Basel University. I am Professor for Regenerative Medicine. I am here today to share with you some of my experiences, and I would like to propose to the Andhra Pradesh Honorable Chief Minister sir about an excellency center, a high-tech campus for biotech and medtech. One can actually create a combined campus for biotech and medtech. Biotech has around $500 billion market. Similarly, medtech also has huge market, close to $500 billion, and this can grow at a 17 to 20% increase annually. That means that gives you a huge opportunity for bigger growth for Andhra Pradesh. Consequently, we can also position India at the global scale. And I would strongly suggest, advise to take this opportunity and create such ecosystem. And creating an ecosystem is extremely important, first of all, to actually attract the key players in the field, and to be able to become one of the key players, we need to have the substance in place and ecosystem in place. And the way to do that is to bring the best brains working across the globe and have the global connectivity.
Thank you, Dr. Srinivas. Sorry to cut you short. We just have 15 minutes. So, sure. But I think we heard the core of your content is on really multi-stakeholder partnerships, with academia playing a very strong role. Am I correct? Mr. Madhav, over to you. A line on what India Health Fund does and where AI and deep tech plays a role and how it can support, not a line, but yes.
So, India Health Fund is a catalytic fund set up by Tata Trusts based on two significant hypotheses. One, that innovation for public health had not received the kind of funding that it needed for development, largely because public health was either funded by governments or represented underprivileged patients. So there wasn't enough return for the private sector to make the investments needed. So Tata Trust stepped up, and this was Mr. Tata's personal passion project, to create a fund that would create technology for healthcare from India for the world. Deep science and deep tech play a significant role in what we do. About 70% of our investments have either been in AI-based technologies or in molecular diagnostics and emerging areas. And very relevant not just for development, but we've been partnering with organizations in the state of Andhra to validate some of these technologies and for pilot scale deployments. So.
And what opportunity do you see? So Krishna Babu Garu had mentioned that there is going to be a medtech center, a virtual PMU. Do you see any opportunity there in terms of collaboration?
I do. the biggest issue in development of AI-based solutions is data. Good data drives good solutions, and access to data is a challenge. The state has the best access to data, and the Chief Secretaries or the Health Secretaries already made an offer to provide mass data.
Yes.
Now, what this can do is ensure that the diversity of patients in the state is used to develop AI-based solutions, which are then more accurate and more accessible to not just patients in the state, but the state doesn't have to depend on AI developed in other parts of the country or other parts of the world, which may or may not have the same level of. So I think there is a significant synergy, and one should really build on this.
Thank you. Dr. Arora, I'll come to you now. You are making notes on the theory of change. So maybe you would like to highlight what some opportunities are from where you come from in where Andhra Pradesh is seeing its 2047 vision.
I think, thank you, and I think it's a dream occasion to be where Honorable CM is listening to you, the Honorable Minister, Honorable Principal Secretary, Mr. Tucker. I think, sir, make AI as a digital public good. In the morning, I think the CM mentioned about Aadhaar, a stack on which we actually built many things. Can AP lead this? When you talk about sandbox, can we incentivize private sector to come, show innovations and take them to scale? For a public health specialist, AI should be for public health. I have no issues with personalized IoTs like smartwatches. I am using one, but then it's not for masses to be used immediately. What is required is how do you do surveillance, diagnosis, outbreak and solutions, including NCDs on a massive scale, and do preventive diagnosis. So for me, the opportunity is how do you make this AI mainstreamed within the health, use it as a digital public health good to deliver early screening and prevent diseases. That is perhaps the one of the most important, and AI will help in research, in conducting clinical trials and giving us solutions, and then government should help them, taking them to scale. Scale comes only with the government's approach. Irrespective of any philanthropy, any multilateral bank, if government adopts it, it goes to a scale, and this is where government can create that differences of impactful intervention.
Thank you, Dr. Arora. Sanjay, I know you from your earlier avatars, and now very nice to know that you've moved to Hyderabad. Question for you, in the space of diagnostics and market shaping of diagnostics, you've been hearing all the startups earlier today, and there was a wonderful stall out there, and you heard the vision of our Honorable CM as well as Health Minister. What does that opportunity look like for an institution like the IKP?
Yeah, first of all, thanks for the opportunity, and thanks to the Honorable CM. I come from IKP, which was set up back in 1999, thanks to the public-private partnership mode, where 200 acres of land was donated by the Honorable CM, who was the Chief Minister of the undivided Andhra Pradesh. So one of the silver pandemic was the unprecedented focus on true point-of-care diagnostics. And when I say, true point-of-care, I want to make a distinction between the regular point-of-care and the true point-of-care. It means that diagnostics which can be as close as possible to the patient. And when we talk about true point-of-care, there are really two trends that are emerging. One is instrument-based point-of-care, and the other is instrument-free point-of-care. And there are, a bunch of technologies which are now already becoming available. So there is one, for example, Plus Life, which is a multiplex true point-of-care, which means that you can conduct or diagnose multiple diseases at the same time on a PCR platform. And they are looking at a disposable PCR platform. And there is a collaboration right now going on between this company and Huel Biosciences, which is a company in Hyderabad. There's another one called Kosara Diagnostics, which is home-based PCR. They have simplified the PCR to an extent where it can be used, within a domestic setting, and they're also getting into a joint venture with a company called Kosara in Ahmedabad. The second key trend in diagnostics is, integrated diagnostics. When you're talking about taking diagnostics to the last mile, you cannot really afford a chemistry analyzer, a hematology, immunology, and molecular. So they are now building integrated platforms where you have chemistry, immunology, molecular diagnostics all happening on one platform, and very simple to use. There are very few companies which are right now in this process, but there is some There are very good chemists and there are very good immunologists here in India and specifically in the state of Andhra Pradesh, and their skills can be leveraged to produce these technologies. There is one platform called Fluxurgy which is in this space. The third trend is obviously looking at alternate sample types. There are newer samples like urine for tuberculosis and tongue swabs for tuberculosis which are now becoming available. They're easier to collect and obviously easier for the diagnostics to be implemented at a field level. The fourth point which I wanted to mention, which you specifically asked about the market entry, is the biggest value of death is that a technology becoming available and it not getting to the masses. So I think it is, I've been hearing since morning that there's going to be a lot of focus on last mile access. Yeah. I think it is extremely critical, for the states to be able to work with these developers in order to make sure that there are mechanisms that are put into place so that these technologies can reach the people who need them the most and at scale. And it is great to see that the state of Andhra Pradesh, under the leadership of Honorable CM, has announced Anantapur as a proof of concept. So these technologies can actually be, tested at a proof of concept level and then potentially be scaled up.
Thank you. Thank you, Dr. Sarin. Dr. Panditi Reddy, we heard today about the state's priorities on cancers, particularly breast and cervical cancer. We also know women's health is at the front and center of the health department's goals. We heard from Krishna Babu Garu actually highlight that. As a world-renowned OBGYN and director of Rainbow Hospitals, how are you already using AI and deep tech, and what opportunities do you see for the private sector?
So I am from the area of maternal health, and it was very interesting to see your presentation, sir. First of all, I would like to congratulate the state of Andhra Pradesh that you have already reached a maternal mortality goal which is far lesser than the SDG expected goal, and you've set for yourself a target which is very ambitious. You want to reach below 5, and I think to reach that below 5 will need a lot of hard work. It's a bit like weight loss. You can lose the first 10 kgs very easily. When you come to the next 10 kg, it's the stagnation. And I think as a specialty, maternal health care lends itself extremely well to technology. It lends itself extremely well to technology because it's a very structured journey that a pregnant woman follows. 95% of the pregnant women go through a very structured journey. The interventions are very structured. They're extremely predictable. Right now, what is happening is that the focus is entirely on what is going to happen during childbirth, how we can reduce maternal mortality during the process of birth itself. And that is, in terms of institutional deliveries and having midwifery-led care. But I think the focus now and what technology will lend itself to should go on to the antenatal care that we are providing for women, because it can be extremely structured and technology can come in very well at this point. And because if you pay attention to the antenatal journey of the woman, you're going to create a woman who's strong mentally, who's strong physically, and who will have less risk of dying during childbirth. While childbirth is a critical period in the journey of pregnancy, it's a very small, the penultimate lap that somebody has to run to go through that process. So technology will play a big role in terms of not just telehealth. Right now we have women coming for about 15 to 16 visits during pregnancy, and that's redundant. It becomes a big roadblock. They should not really need to come to the hospital more than 3 times during pregnancy, and the rest can be taken over by telehealth. And by telehealth, I just don't mean teleconsultations. I think in the field of pregnancy and childbirth, education plays a big role, and I think technology should be leveraged to educate not just women. I think at this point, reducing maternal mortality should shift to families and communities also, the responsibility. So I think it should become a community goal to ensure that no pregnant woman suffers any complication. We also have a number of AI systems which we are using right now to risk stratify women at very early stages in pregnancy. So by the end of the 8th week, before even the 3rd month, we can risk stratify and say which woman can develop preeclampsia, which woman can develop heart disease, which woman can die because of bleeding. And I would envisage a time, sir, where no pregnant woman should ring at 3 a.m. and say she has palpitations. We should know at the onset of pregnancy which woman can have palpitations and prevent them before they occur. And building women antenatally, making them strong mentally and physically, is not just going to reduce death in childbirth. it should simply reduce the risk of death in childbirth. And that will happen by leveraging technology to spread education. And education is the single most important thing. And antenatal visits now have become about eating iron, calcium and taking tetanus injections. And that should not be the focus of antenatal care. It should become a way of life. Pregnancy,
Thank you.
9 months should be a way of life.
Thank you, Dr. Reddy. Thank you for eloquently expressing what's available right now in AI. Amit, I know you for many years now, maybe 15 years or so, and your deep work in AP and financing health sector reforms. So can you speak to this audience about what's the next movement for the bank, especially in this particular area of AI and deep tech?
Thanks, Angela. So let me first acknowledge, the kind of health outcomes the state has achieved in terms of your, maternal mortality, neonatal mortality, and so on, has been pretty good. And this is as a result of the outputs which we see in terms of the improved immunization and the institutional deliveries. And all this have been driven through the kind of investment the state has put in the human resource for health. AP is the only state in country which has less than 5% vacant position of specialist, which no other states could achieve. Your health infrastructure has been significant in terms of the access. 3, the kind of data or the digital interventions which we see is tremendous, and Krishna Babu sir has already put the numbers very clearly. So these are like few very clear outcomes which one can see. However, the challenge is we have solved for the access, but the quality still continues to be the issue. And the majority of the deaths which are happening are largely because of poor quality of service. So that is something which one has to look at very carefully. The other challenges are also being related to, your communicable disease like TB. The number still continues to be the high. The number of C-sections and the teenage pregnancies and the adolescent health is also a larger problem. And until unless we try to resolve that, I don't think so we are going to really achieve what we want to achieve. Before I close, there are a couple of just 2 points which are very important. Again, the health insurance program in state is pretty old, but it's not the coverage which is important. It is the effective coverage which is very important. And when I say effective coverage, probably, even if you are able to look at, access to a comprehensive care package, which can ensure reduction in out-of-pocket expenditure. So let's, maintain up to 20%. That would still be a good deal in terms of looking at the overall thing. Second point is the epidemiological and demographic transition, which is beyond our control right now, have posed several challenges. Now, whether it is in terms of your aging population, your non-communicable diseases is still not being controlled. And there are interventions which are outside health, as Dinesh rightly mentioned, need to be handled carefully.
Thank you. Thank you so much. Dr. Sanjay, I called you here for 2 reasons. One is that you lead the Axel Priest School of Public Health, and you also have a school on AI and robotics that I want everyone to hear about. So I want to know about the collaboration between the School of Public Health and the School of AI and Robotics. And second, I know that you have a special invitation for everyone here, so the floor is yours.
Thank you. I'll explain the philosophy behind why we have 2 schools. I think every university has a unique opportunity to create an ecosystem, because university is basically a universal knowledge hub. How do you ensure that there's a cooperation? There's a philosophy behind it. See, the training programs are sectoral, but the problems are intersectoral. We need to really think about our education system. Are we doing intersectoral programs, or are we still being a silo in sectoral programs? Policies are mostly sectoral, but the problems are intersectoral. Then again, policies are national, but the problems are international. So intersectorality in education and research is extremely important. This is the philosophy behind. At NIMS University, we have Institute of AI, Robotics and Cybernetics. In the same campus, we have a medical school. and we have a public health. The message here is very clear. When you talk about AI, there's a triangle which influences the way you work on. One is security, the other one is privacy, and the third component is business. So how do you balance this triad becomes extremely important. So one message I have, to the Andhra Pradesh, which is doing extremely good. I'm extremely happy here listening to all the developments. My only request is, if we can invest on primordial prevention more, because by doing this, you are actually intervening before the emergence of risk factors. So we have to deal with unknown unknowns. Right now we are doing good in known knowns, known unknowns, but the future is unknown unknowns. So you need thinkers and implementers in this area.
Thank you so much. And what about the special invitation?
Yeah, this special request to the Honorable Chief Minister, sir. Sir, NIMS University has taken the lead to host the World Health Summit regional meeting in New Delhi. World Health Summit is happening in Berlin since 2009, but this is the first time in India. It will be hosted at Bharat Mandapam from April 25th to 27th. What I told Berlin team was a very bold statement. I said, you have a history, but we will create a history. Sir, please accept our invitation as guest of honor. I know from the we'll be very happy, sir, with the developments, with the case studies, because the regional initiatives which we start have a global impact. But nowhere, because as Indians we are very nice people, we don't speak much, but we do a lot. Sir, please accept the invitations. Thank you, sir.
Thank you very much, Dr. Sanjay. Before we move on, I'd like to invite Ms. Vinutna, the Assistant Collector of Anantapur, who has actually started using the virtual PMU already to draw some conclusions of her own. So if you could quickly come up to the dais, because we've been told we're really running out of time. Thank you so much.
Good afternoon to Honorable CM Sir, Honorable State Ministers, respected Chief Secretary Sir, all the respected seniors and august audience present here. I am Vinutna IAS 2023 batch, Assistant Collector Anantapur. Sir, as an aspirant preparing for the civil services exam, healthcare is always an area of deep interest. Now after 7 months of entering into the service, it has become real and I realized the crucial role healthcare plays in governance. It is a matter of immense pride and with deep gratitude, I stand here today to share with you all the pilot data analysis project we are working on in Kuderu Mandal of our district Ananthapuram, in collaboration with the Swasti team and under the guidance of our district collector sir. As a part of the vision of our Honorable Chief Minister sir, in line with the Vikasit Andhra Pradesh 2047 and also Vikasit Ananthapuram 2047, out of several others, 2 of the major targets we have chosen include from 23 per 1 lakh live births of maternal mortality rate as per NFHS 5, we want to bring it down to 0 and reduce the anemia incidence percentage from 57 to less than 1% and intensity level in a targeted manner from severe to moderate to mild. Aligning with these thoughts of the district administration, Swasti team had come to Ananthapuram, coupling with their concepts of precision action for the climate health and virtual PMU, we worked extensively on data and came up with a pilot Swarna Ananthapuramu analytical dashboard. So as mentioned by our Honorable Health Minister sir, re-emphasized by the Secretary Health sir, we have humongous data being collected on a daily basis at our PHCs, sub-centers in India. Andhra Pradesh stands first in place in terms of electronic health records data. Swarna Ananthapuram is one such data analytics dashboard platform that aims to put this data to right use for the larger public good. For doing this project, sir, we have chosen a PHC in Kuderu Mandal of the district, which is catering to 40,000 population and that is receiving 100 to 150 cases every day. So these are the objectives, sir, which we aim to achieve using this platform Swarna Anantapuram. One is data triangulation. First, we have different sources of data. We want to bring it all to one place. Comprehensive and advanced analysis. We have realized it, sir, we need a life cycle approach. There are so many forward and backward linkages. Maternal mortality is not exclusively maternal mortality. There's also forward linkage to it and there's also backward linkage to it. So we have to do comprehensive and advanced data analysis, and this will aid us in evidence-based decision making. And also this dashboard aims in addressing the issues at the right levels and timely escalations whenever needed. So what is, next slide. What is the methodology we have adopted is the given below. One is, first we have reviewed all the data. We have various sources of information like seasonal diseases, TB, leprosy, malaria, dengue, non-communicable diseases. There's so much of data, we reviewed it all, and then data triangulation has happened, and then data engineered, cleansed it, filtered it and processed so as to derive appropriate insights that will in turn help us in making the right decisions. All of this will ultimately help us in making tailored interventions and customized decision making. The dashboard is as follows. Next slide. So this is the Swarna Anantapuram dashboard, where what is shown here is the climatic patterns and the key trends of health indicators. So these are the pregnant women, number of ANC visits done, timely visits percentage done, number of anemic women, and also percentage anemia improved, and the last 2 years maternal deaths recorded. Next slide. This is an interesting correlation between, if you see in the graph below, there is a certain spike in particular months of the year where because vector-borne and water-borne illnesses in that months of the year are rising, and that heat map is the diseases vulnerability of the respective mandals in the district. So this is the spikes we observed in the months of the digit. So now we analyze it that this data analysis and evidence based, we can take it a step forward by integrating it with AI powered prediction analysis and understanding and foreseeing the future. Next. So these are the 3 steps, the 3 triangular steps. One is bringing it all together, then virtual PMU, bringing it all together, and AI and ML, risk prediction, then progression tracking, response prediction, predictive modeling, and also flow management. Adopting a life cycle approach, we can do this customized treatment plan. Next. So we have also seen that for all the technology to kick in, we need to plug small loopholes which we have at our ground level staff. One is that they are the ultimately entering data, they are doing it, they are the field level functionaries. So the connectivity, logistics issues, and the capacity building they need, the training we have to impart to them, these are the things that needs to be emphasized, and also awareness and de-siloization between different departments. So sir, I would like to end with a quote of which says that humans have to struggle against exploitation. The real big struggle will be against irrelevance. To keep our PHCs, health and wellness centers ever relevant, data and deep technology should enter into them when the time is right. Thank you, sir.
Sir, Honorable Minister, I hope you're feeling very proud of the Anantapur team, because they actually did this in less than 72 hours. Less than 72 hours they put together this dashboard, and Ms. Vinutna only found out maybe 24 hours ago that she was to make this presentation. So we are very proud of Anantapur team, and you should be too. I'm told that we have to vacate the stage right now, so that's all the time we have. I'm really sorry. Thank you. Please give a loud round of applause to the panel here.
Thank you, Dr. Angela.
Thank you very much.
And I thank all the panelists. Sorry, if we have more time, a lot of insights would have come, but nevertheless, there is always next time. Thank you very much. Ladies and gentlemen, Now we will move into the most exciting session where Honorable Chief Minister would like to interact with participants, key stakeholders. I am sure it would be very, very interesting session because I have conducted a couple of them in Hyderabad. So it would be my pleasure to invite him and Thakkar sir onto the dais. Then this session will be moderated by Shiv Kumar, Chief Executive Officer, founder of Swasti. I request him to come onto the dais. And we have 4 students moving around in the audience who have mics. So you can raise your hand and ask them to give you mic. But please be brief. This is not a speech session. Be quick if you want to have a suggestion or ask a question. Then Honorable Chief Minister would definitely would like to interact with you.
Good afternoon, ladies and gentlemen. Can you hear me in the back? Raise your hands if you can hear me in the back. Put both your hands up. Okay, now clap. I would like you to clap really loudly, because we're going to have the Honorable Chief Minister interacting with us shortly. As CM Garu comes onto the stage, I'm going to have a special request because we had a panel which got cancelled earlier, and I'm going to call on those names first for the individuals to speak. Honorable Chief Minister Chandrababu Naidu Garu and Mr. Thakkar Garu, welcome back to the stage. This is a great opportunity to interact with the audience. Audience, I'm like people say, right? Don't stand in the way between lunch and us. But I'm going to stand in your way. I'm going to help you ask the questions so that CM Garu can respond, or if you have any advice to offer. There are 3 things we're looking from you. One is, do you have a question? Do you have advice for Andhra Pradesh? Do you have a suggestion to make? And I would request you to be very brilliant. What I mean by that is be brief. No more than 10 to 20 seconds, because we would like to, and I'm sure CM Garu would like to hear from all of you who have a point to make, right? There are going to be 4 people, students. Thank you, students, for helping us move around. Can you put your mic up so people can see you? There are 4 students who are helping us. Please give them a round of applause to the students. They will take your points. So the way we will do this is that, as I said, if you have a question, if you have an advice or a suggestion, please make that clear to us. Sure. So the way we are going to do this is that mics don't work in the back. For practical purposes, people who would like to make a suggestion or a question, we would like you to line up in the middle. And I'm going to first call on certain people to come to start the discussions first. Mr. Paneer Selvam, Chief Executive, Meitei Startup. Sir, we couldn't hear you in the panel, but we would like your views. If you can come forward, please. And can a mic be organized for Mr. Paneer Selvam, please? Mr. Ram Prasad, thank you. In your back, sir. Yes, please.
Very good afternoon, and thank you, sir, for this opportunity. I'm the Chief Executive Officer of the Meitei Startup Hub from the Department of Electronics and IT, Government of India. We are an organization, the deep custodians of deep tech startups in the country, and we are very privileged to be part of this conversation. We would have loved to have more time, but 3 things that I would like to share as part of how we can make Andhra Pradesh. One of the things that we see in the startup ecosystem is essentially a lot of our startups are solving problems for the urban India, and they really don't know, or they are not really aware of the problem statements from the rural part of the. So one of the suggestions that I could suggest is have a problem statement repository by the government, organized by each ministry, centralized, where entrepreneurs, innovators and problem solvers can access these problem statements at a centralized place and pick up problems of their choice and start resolving them. I think that's something which is very, very important and critical. And the second aspect we have is a suggestion we always look at. There are only two customer segments for the startups. First is government, second is corporates. And the government is doing their role, and corporates are, a lot of corporates are setting up their corporate accelerators, corporate innovation program. There's a successful program in the central government called IDEX, which is the Defense Innovation Organization, has been running for last 5 to 6 years. And there's a model that almost all ministries can replicate, because they put out problem statements. They have their, one of the mentors from the departments mentoring the startups, handholding the entire journey and taking them to a logical conclusion almost for about 2 to 2.5 years time. And it is a very strategic program that is in nature. And that's a model that most ministries can replicate. And from the Department of Electronics and MIT, I assure you we will be very happy to partner, and we will share the know-how how we can take it forward from the Andhra Pradesh government side. And the third and the important element is fund. A lot of government focus on funding, which is essentially important. But the truth is, there's more than money that we can give the startups, which is a procurement policy from the startup ecosystem from each of these departments. Because again, it's better to teach them how to fish rather than provide them with a fish. So it's kind of each department can set aside a certain percentage of procurement or from the policy, in terms of that they can need to source this from the startup ecosystem. So these are the things that we really want to look at as suggestions from the startup side. From the Department of Electronics and IT, we are always there to support the government of Andhra Pradesh. And as a CEO of MSH, I am very glad to see how we can. Andhra Pradesh has a great opportunity to kind of work with us, and we have the opportunity to work with them to kind of drive the startup ecosystem in the states. So it will be our pleasure to kind of again connect and maybe have a detailed discussion, sir. Thank you.
Thank you, Paneerselvam. CM Garu, one of the things which came in the yesterday's roundtable was that many times startups and medtech people come with a solution looking for a problem. Can the government be very clear, say these are our problem statements? For example, sir, the Dwakra groups that you started off, can they now move online? Can there be a virtual self-help group? If we can put those problem statements clearly there, I think that makes it easier for the startup world to interact. Over to you, sir.
As rightly mentioned by him, as on today, we are having some problems, but we want to create excellent ecosystem. That's why we brought so many policies now. One is innovation hubs. In innovation hubs, we made 5 zones, 5 innovation hubs. For example, Zone 1, Uttarandhra, 3 districts, Srikakulam, Visakhapatnam, Vizianagaram. Then Zone 2, that is East Godavari, West Godavari, Godavari districts. Zone 3, Guntur, Krishna districts. Zone 4, Prakasam, Nellore, Chittur. 5th zone is Anantapur, Kadapa, Kurnool. 5 zones we have created. We thought this is most viable. Then there will be central hub, that is Amravati, to supervise, to guide them properly, everything. Name also we name Ratan Tata Innovation Hub. Here, as he rightly mentioned, one is a knowledge economy. And also our program is one family, one entrepreneur. This we wanted to make it reality. Then I had to create the best organization for this total mentoring, venture capital, and how to identify everything in that regard. So we are also discussing with all of you. Ultimately, I told you morning also, as on today, some of the applications we are using. But so many applications we are not using as on today. Either knowledge economy or so many things. I can say how to encourage them continuously. We want to create 500 crores like that. Innovation hub, corpus fund, how to meet all these things. 5 zones, excellent industries who are all located in that zone. One top industry and also other industries present in their area will make it a body. Then academic institutions, these 5 zones, 5 areas we are having excellent academic institutions will integrate. Then we will bring venture capital. We need mentors. That is where other ecosystem also at all necessary will do it. Morning also I told very clearly knowledge economy, sky is the limit imagination. If you want to achieve all these things again, in knowledge economy data is available. As one example, just now my health secretary has given presentation. Ayushman Bharat, we are able to establish reasonably well. We can make it next level. That means 90%, 95%. Data is available. All this data, due to privacy, all these things will mask it, we will put it before you. You come innovative ideas. Now Kuderu, one case study that is working. Some people have come with a pregnant lady, how to monitor. That is where our Dr. Rakesh has given a presentation morning. So like that, so many use cases are coming. What I wanted to request here, not only here, by seeing all these things, who are all innovators in the state, who are all innovators in the nation, even global innovators, come back with proper use cases. Even technology always, it should be more cost effective. Be clear. This is where I am telling, even if you come with high cost, low productivity, no result, less results, then it may not be sustainable. That is, if you can come, morning also, our minister also has told very clearly, we will create an organization. How to hide single window, all your use cases you can come to that organization. Respective departments they will coordinate. Your use cases are useful, straight away they will use it, and at the same time, proof of concept. First they will use it, pilot, automatically it is very good, then we will replicate, then we will give you results, then proof of concept will establish, then you can go to national level, international level for your product launching. This is where I am saying from the beginning. Today, not only one thing, what all we are thinking here, somebody already in advanced stage. So many brains are working globally. So early is the best way. Very soon I am hearing all these things from you. Very soon we are going to establish that type of ecosystem in Andhra Pradesh. Then trial and error will work continuously. Ultimate aim is, I wanted to make Andhra Pradesh a hub for knowledge economy, number 1. Number 2, every family one family, one entrepreneur. That is our mission. We will work together. And also innovators, I am appealing all of you. Recently we had a drone conference. Nobody visualized the importance of drones. Excellent use cases have come. Even some of the use cases I am shocked to hear, they are from remote area. Imagination, even they didn't have proper educational background also, they are innovating. Even intermediate students. Even Srikakulam remote area, people have come. And also by always one, if you know, if you see, all innovations were done not universities, sometimes outside universities. Not best graduates, even illiterates, dropouts. Even Bill Gates also drop out. This is where things are happening. So we will work together. This is the, I am very happy, everything we will publicize. You need not go to anywhere. There will be clear portal, committee, use cases, they will talk to you, we will adopt straight away and then we will give you proof of concept. We will do it. Thank you.
Thank you, sir. Sir, yesterday we had around 150 people in the room. Tucker sir and Kutumbarao Garu was also interacting. Two problems came up, sir. One is government's ability to transparently procure medtech or any other tech in a way that we get it at the right price. As you rightly said, technology should not be expensive. It should actually reduce cost. So we need a policy and a system which enables procurement by the government to happen smoothly. And one big challenge, sir, given the rate at which the technology is growing, sometimes our capacity to even understand the speed at which it is going may stop our ability to evaluate a technology. So any thoughts, sir, how government can build an ecosystem as you're envisioning, which involves both being ahead, but at the same time being transparent?
No, we'll do one thing. Even I can take associations or experts from outside, right, and also government people. Ultimately, government is supreme. It is a sovereign power. You have to accept, but sometimes you are having reservations. Government means it won't work. It will create problems. There will be hurdles. That is where we are thinking why people are going to Silicon Valley and launching the projects. There is a proper environment. Even in morning I have seen some presentations. Same time South Korea or some other countries have started economic development. They have reached new heights. But India is moving lot of potential, hidden potential. We are unable to expose all these things. But ultimately anything government has to promote. That is where Hyderabad success story. In the initial stage, small problems will be there. We will create a best ecosystem to take forward. I am assuring you, without having any bottleneck, I want to promote entrepreneurs in a big way. For this, we are streamlining total administration, and also it will be responsive. And at the same time, I will involve associations and also experts from private sector also.
Sure.
We will work together.
Thank you.
Even always startup companies, out of 4 or 5, every startup may not be successful. We are seeing. But we should not discourage. Continuously, sometimes 1 or 2 failures also, we must be in a position to absorb and encourage further. That also we are keeping in our policy. We will work it out.
Thank you. Thank you so much, sir. Then we have a big round of applause for that, please. This is one of the most encouraging things, sir, because without that ecosystem, the private sector also cannot interact, but government also can't get the best out of the industry. Sir, with your permission, I would like to call on Mr. Manish Gupta from SAP. Manish has come all the way and he's from one of the most leading companies. Manish, over to you, please.
So my latest and greatest qualification, sir, is I am a father to two daughters. One is 11 and one is 6 years old. Both of them go to Blue Blocks Montessori in Hyderabad for last 8 years. And we were having a conversation last week, and one of them, the elder one, says that she wants to train and she wants to help the rural children by staying in Hyderabad so that the rural children or the rural society can earn their pocket money. My elder daughter is very good in origami, which is a paper crafts, and that initiated the thought in mind how we can actually utilize everybody who knows something in this state or in this country, that each one skill one, right? I will skill somebody, everybody present in this room will skill somebody. That's one of the thoughts. I'll take this back to my daughter and say I was able to bring this point to you. The second point, sir, is while terrestrial, we are doing a lot of interesting things in the state, in the country. It's nice to have the eyes in the sky, right? There are a lot of private companies which are sending CubeSats to space, in the low Earth orbiting space, and some of these can be used by the state machinery, by GFST, to identify a lot of interesting use cases. One is disaster management, the other is land monitoring. So once you have eyes in the skies 250 kilometer up, there is so much possibility to do so many interesting things. I know one of such startups who would be willing to explore some of these interesting use cases. I cannot comment on the commercial part of it, but at least something very interesting that can be brought up. The third thing was, sir, since I come from a technology company called SAP, we work very closely with enterprises. And I think government should also be treated like an enterprise. You earn money, you spend money, and there's an entire machinery which works. And if all the systems that are deployed connect to each other in a recent way, then what stops Andhra Pradesh government to function like a Tata Motors or a Tata Projects Limited, where everybody has the right insights, he knows what to be done, and they're getting the best service out. In this case, the customer is a citizen. Right? The second last point was, sir, is the last mile is a big challenge because the government can have as only about this many people, and we have a large population in the country as well as in the state. There is one interesting concept of resident welfare associations. Now, interestingly, they are all registered bodies, and all the members are elected members. The housing committees, everybody comes together and elects those members. Can these RWAs become an extension or a quasi-government extension to the localities where they can help in the locality development, problem solving, etc. And fifth one is, my question to you, sir, is why is governance needed? Governance should be working automatically. The day I am born to the day I die, everything should happen on its own. And if that happens, with your vision of speed of doing business can happen on its own. Thank you, sir.
Thank you, Manish.
Last point, I am assuring you, it will happen very soon.
Thank you. I can see that
That
happening.
means we are starting now WhatsApp governance. Government always wanted to control. As a matter of fact, we want to facilitate. We are forgetting facilitator role, then we are entering to controller role. For example, as you rightly mentioned, only human beings born only once and also die once. For these two things, MRO is going to update continuously with his discretion. What is the fun? I don't understand. Once he was born, it is noted, automatically anybody will come, date of birth has to give automatically, wherever he is. Nativity cannot be changed, caste cannot be changed.
Correct.
Percentage of schools or certificates, college certificate marks cannot be changed.
I agree.
All these things you have to go to pillar to post every year. Very soon you are going to see you will not go to anywhere. All these things you can download anywhere in the world at your convenience whenever you require. Not only this, more than 100, or gradually I am making everything seamless. You can take services, power bill you can pay automatically, electricity bill or something, everything. Even you want to go to any temple, you can reserve ticket. By the time you can go and have darshan and then come back. All services I wanted to provide in a big way. We have started. That is where morning I told you very clearly. One is Aadhaar. It is a very good advantage for India. Second is your telephone. Now, OTP, all these things are coming. Now every family, every member, wherever you go, airport also, no need to have your passport or your ticket, all these things. Directly you can enter and go. What more evidence you need? So I wanted to move in that direction. One is individual, Aadhaar, bring them as a family, who are all in the family. Then GPS, then everything will be authenticated. I will know what are all the requirements for each citizen, each family. Either house, outside or some other else, everything will make it. Finally, we are planning in such a way, welfare for the deserving people will give, and also tax payments also, one should pay transparent way, without having any evasion. We will bring revolution with technology. As on today, we are using technology as standalone system. I want to bring technology integrated.
Absolutely.
Very soon we are going to bring it. That will help us in a big way.
Thank you, sir. And I promise you on behalf of the citizens of this country here, that if the government is going to take 2 steps, we will take 20 from our side. Thank you.
No, only sometimes we are not moving that fast. The motivation also is a big problem for me. Visakhapatnam is the exception. Visakhapatnam always very good city and also very, very committed, very docile people and also honest and integrity is very high. I have seen so many cities.
This is my favorite city.
Visakhapatnam is different from other cities, but people are by and large very good. But only problem is continuously intellectuals, you are having a responsibility, which is good, which is bad, you have to identify. Continuously you have to support good, then only things will happen. Sometimes you will vote for any party, after that you will think, this is our responsibility, you have to deliver, but you won't cooperate. I need continuous cooperation, then we can do wonders.
All the best.
We'll work it out.
Thank you very much.
Thank you, sir. Thank you so much, sir. May I, in that light, there are over 3,000 schemes and programs for the poor. Some of them are central schemes, some of them are Andhra schemes. And when we mapped it out, one of the things which came out is, as you were saying, deserving people, if the scheme is there, they should receive it. But there is an application process, there is a documentation process. Can we move one step further, sir? We have the DigiLocker concept. Can the DigiLocker, if all the documents are available, right, and if the family is eligible for certain things and they don't have it, is it possible to automate it slowly over a period of time?
That is what we are working as on now.
Okay, sir.
As a family, what are all the schemes is eligible? As a family, what is the economic status? What is the skill or potential of that family? In a family, 5 members, all are not equal. One family member is having more IQ or advantages or skills, everything. So I wanted to plan everything. Individual identity, family as a security. Both will integrate. Automatically we can synchronize all programs with that family is eligible and then we will apply for them.
Wonderful.
All of a sudden we may not do it, but minimum programs we have to target all families.
Thank you, sir.
There is pension, there is ration, there is health, all these things, everybody is eligible. Some programs, those who are all, that is where I told you, zero poverty P4. There I will focus more on last mile. then they will bring them. For others we may not bring, but at least we will uplift. Continuous process. That is where we are doing. As I rightly mentioned, all programs I want to synchronize. Still there is a problem of literacy. Common man in the village may not understand, but our secretariat in the last mile, they have to coordinate, we will coordinate.
Sure. Thank you, sir. Thank you. Can I see some hands up, questions? Okay. You will need to move forward and take the mic. And while we do that, do we have Rohit from the Piramal Foundation here? Rohit? Rohit, can you come forward, please? This is a subject which you are very familiar with. So we have from Piramal Foundation, Rohit, who's done some amazing work on digital governance. And Rohit, if you can talk quickly to CM Garu about your entire DigiLocker approach and how it can be done. Then we will, ma'am, you go ahead first, please. Okay.
Sir, I'm Lakshmi, speech language pathologist and audiologist.
Mike, nearer.
I'm Lakshmi, speech language pathologist and audiologist. Here I've been hearing from past 2-3 hours about technology and healthcare. But as a speech therapist, every day I'm seeing around 10 to 16 children who are having autism, mental retardation, misarticulation. They're not able to pronounce even a simple word properly. So all this is sometimes because of electronic gadgets mothers are giving right at the early age, and about very poor awareness about speech and hearing issues, about communication issues in the health sector. So what we thought was earlier, see, I have a Vishaka Speech and Hearing Center from past 20 years. Earlier we used to have an Institute of Speech and Hearing in Hyderabad. But after bifurcation of the state, whole of Andhra, we don't have a speech and hearing college itself. So hardly we have 100, we have an association called Andhra Pradesh Speech and Hearing Association. The whole of Andhra Pradesh Association, we have 20 to 30 speech and hearing professionals who cannot service or give awareness to all these people of our population. So we initiated permission from Andhra Pradesh to start the speech and hearing college. The problem here is we do not have faculty. So they keep asking for where is the faculty, how can you educate the bachelor's or diploma course students if they come for.
Sure.
So we would like to ask, in case if we can have virtual lectures from all over the world, even from Basel University we have people coming here who are pioneers of this speech and hearing communication disorders. Until we have this virtual permission to implement in colleges like us. See, ours is a very small firm. Vishaka Speech and Hearing is hardly 20 years young. To get permission, we have to go to Rehabilitation of Council of India in Delhi.
Ma'am,
so they have particular steps.
You're asked, what is asked for you?
Yeah, so what we wanted to ask is, their permission they will give only for the faculty. But in case if you can help us with a virtual permission to get lectures from online, then we can have multiple, by 1 year we can have 20 speech and hearing professionals developed in this state.
Right.
So every year we can develop so many speech and hearing professionals and help our future children who will not have any communication or speech and hearing problems.
Thank you.
Thank you, sir.
What about our secretary?
Krishna Garu?
Krishna Babu, you will answer.
Sir, Elite Council actually, RCI mandates physical lectures, availability of physical lectures, sir. We will just check up, sir, and whether that kind of faculty is available or not. Otherwise,
what our suggestion is, we will have one college,
yes,
both virtual, physical, integration of lectures globally, and also continuously we will train our people. That is one. Second one, Government of India permissions. How to get it single window? Can we get it?
Yes.
Simple question.
RCA has to give NOC, sir. She has already applied. We will follow it up.
Not individual case. I am not bothered about. She brought a problem.
Yes.
How to make it effective implementation, free for all, but no children in Andhra Pradesh should suffer because of that lack of infrastructure. How to do it, you tell us.
We will work together, sir.
You take suggestions and get it done.
Yes, I have taken number, sir, her number. So
Okay.
we will work together. Sir.
How many students are there in Andhra Pradesh? Everything. How many children?
Yes, sir.
Okay. You give the details, we'll get it done.
Thank you.
Okay.
Thank you. Sir, your point is that estimate the total number of children, how many people we need, and solve it at a system level.
Namaste, welcome to
Sir, I would
INBTVNEWS
like to
Munduga
invite
headlines.
Rohit, very briefly. I would request all speakers to be very brief. Rohit, if you can share the Digital Bharat Collective work, and if you have any ask from CM, sir.
Sure. Thank you, sir. Sir, myself Rohit from Piramal Foundation, and we have an initiative called Digital Bharat Collaborative. Under that, we are committed to strengthen the health system in the states. We have piloted our programs in Bihar and UP in collaboration with the state government, wherein the command and control center at the state level is formed, which was inaugurated by the CMs of the respective states, whereby we could able to really monitor and govern the programs, health program from the state, as well as from the districts with the different district magistrates. We could able to establish the review mechanism over there, and in the block we could able to help to the officials in creating the differential planning for improving the indicators of the health in the block. And finally, with the frontline workers, we've been helping them to really build their capabilities in managing her work. So this work has been done extensively from last 4 years with the states, where we started building the blocks from creating the digital architecture in the states, as well as governance mechanism in the state. I'm hoping that with this learning, if we can able to also come to Andhra Pradesh and can able to contribute also into the development of part. Thank you.
So what is your suggestion ultimately?
So suggestion is that at the state, one of the learning for us was that there is lot of, as sir was also saying, we have a lot of data, but where is this data all going to? Is this data actually used to drive the programs for better? I think if we can able to at all level able to create the right information to the right person at right time to drive the right decision, we can able to solve this at a better way. And in the state, if we can have this command and control center which can have a surveillance of the facilities.
What is your expertise? What is the product you are having on that?
Sir, at every level we can able to help in the creating governance mechanism and deploy the digital solutions. And with the youth, we have almost like 600 fellows working with us which are between the age group of 20 to 26. They are the one who is doing the change management on the ground.
Right.
And these are the people who actually passed out from the IITs and good colleges of India, 100 top colleges of India. They actually go and stay in the villages, work with the community, support the system in establishing the change management and deployment and adoption of the programs.
So Rohit, if I may help you reframe, sir, I think the work they have done in UP and Bihar is they built multi-level dashboards using government data, and they also mobilize the youth to verify the data, and multi-level governance has become possible, and that's a solution they are willing to offer to Andhra Pradesh.
What I am thinking, we are also working everything systematically, all departments, and also I told you, as on today, governments are using data standalone systems. Because of that, we are having a problem of comparison, all these things. Now I am bringing uniformity. If he is having any ideas how to integrate, we will be very happy to associate with him.
Sure.
Even not only Andhra Pradesh, even I am integrating with the government of India, Ayushman Bharat, APAR, all these things. That data also I am integrating. So that single source of truth, so that decision making will be very easy. Or otherwise multiple channels again will have a problem.
Absolutely.
If he is having good ideas, we will sit with you. Even we are using all knowledge available for overall improvement of the society, either health, agriculture, all departments of the matter.
Sure. Thank you, sir. And like Krishna Babu Garu is already doing, he is integrating multiple department data for health.
Yeah, we will do that. I am telling you government approach, very clear. As on today, historical information we are having, some of the departments, but stand alone. Pensions, one format, one department. Health is different, or ration is different. Like there are so many departments, so many ways we are using.
Right.
Now I am bringing one citizen, all services, one family. This is the concept we are working. Historical data we are having, dynamic data we are collecting through Ayushman Bharat. Every day somebody is going to doctor, he will treat, he will update data, that type of data. Second, through IoT's data or CCTV camera data, or tomorrow drones I am sending that data, every data. By using all these things, then I want to go artificial intelligence and also predictive analytics, finally ML, AL, anything for a matter, then deep technology.
Right.
Ultimately, I want to provide best solution for the problem without confusing anybody. That is where nowhere in the country as on today, governments have done. First time I am approaching integrating with all the data. Truth is one. The truth, how to bring it, individual, family, on various problems. It may be health, education, skill, agriculture, anything for that matter. All layers we are building.
Right.
There, if you can come any ideas, we will be very happy to associate with you.
Thank you, sir. Thank you very much, sir. With your permission, somebody has traveled a long way to meet you, son of the soil. Principal Secretary from Meghalaya, Mr. Sampath Kumar is here. I would like to invite him to come on board and share with us his thoughts. He's put a lot of thought about Andhra, what needs to be done.
They are doing some work.
Thank you, sir. So, sir, first of all, I would like to thank you, sir. In fact, you provide a very inspiring and exemplary leadership for the whole country. In fact, so one thing, sir, I would like to tell about a use case. You asked about use cases. Sir, Meghalaya is a small state, but a very difficult state, sir. So, for last over 5 years, we have been working on one model, sir, based on what you said, population management. Sir, maybe I just like, there is if you look at, sir, in India, average below 18 years, about 35% of the population, sir. Meghalaya, we have about 49%. So basically what you just said, sir, we have a demographic dividend, but are we actually unleashing the potential of the demographic dividend? So when we look at the indicators, sir, like if you look at, sir, we have 35% stunted population. Stunted population means their brain cognitive capacity is not fully developed. Similarly, we have, look at the data, like class 5 students cannot actually apply the numbers. Class 5 students cannot simply comprehend. So there are almost like 45 to 55% students are not able to achieve that learning outcome. So investing on people is a great idea, sir, what you are saying. So what we did, sir, we created a human development pyramid based on the brain science. So brain science says, sir, in first 5 years, actually we in fact 90% of the brain develops. So in fact, if you see one Harvard Center for Developing Child, the graph, I think maybe you can show it next slide. So what happens, sir? I would like, maybe you can see, this is the kind of a thing, sir, maybe just a slide that we have shown. So this one, sir, the brain capacity, the neuroplasticity we call it, it's very high during the first early childhood development period. And the second opportunity is adolescent development period. So if we invest in during these two periods, we get actually phenomenal results. There is a study done in US, the Perry School project, which shows that, in fact, the Nobel Prize winner, he had proven that for every dollar we invest, we get almost like 17 times return on investment. So investing to do that one, sir, what we did, we formed a human development council headed by the chief minister, sir, and then integrated all the departments and prioritized all our actions towards unleashing that potential. So even training the parents how to do positive parenting, how not to do altercations or anything before the children so that it will affect their brain. So such kind of a very intensive exercise we are doing. Sir, actually we have set up a government innovation lab in Meghalaya. In fact, our Honorable Chief Minister also, like you sir, he is also very, in fact, very innovative Chief Minister. We all wanted to come and, sign a MOU with the government of AP. And in fact, bring a lot of these ideas. In fact, we are learning from the state of AP. We have taken our CRPs from here to Meghalaya, who are teaching us natural farming. So what you said, sir, knowledge economy or knowledge, you wanted to make it. I think the sharing of the knowledge and, sir, the ideas will be very helpful. We would like to, in fact, put forward this idea before you. But thank you, sir, for all your inspiration.
No, what is your, when you started this project, how much time, what is the outcome?
Sir, actually we started this entire idea, we started during the COVID, sir. COVID gave us a lot of opportunity for us to really deeply think. So the outcomes, sir, actually would like to show, this actually, sir, this is a project, but I would like to show there is a 50% reduction in the maternal mortality rate, sir, in the state, which is the sharpest decline anywhere in the world. In fact, which has been, sir, actually now Harvard University is actually taking it as one of the cases to teach as part of their courses. So that's the kind of a result, sir. So basically, in fact, ADB, I think Dr. Dinesh Arora spoke to you, World Bank, they're all working with us, sir, basically investing at different life stages. Maybe investing on people like Gurujad Apparao garu cheppinattu, sir, like maybe like Desamante Matti Kadu, Desamante Manushuloy. I think, sir, the way you just mentioned population management is so important. Otherwise, the replacement rate is coming down. Definitely, sir, I think we need to unleash that complete demographic dividends. Thank you.
One is the demographic advantage. You are able to do population management also simultaneously?
Yes, sir. Sir, because, sir, to unleash that early childhood development period, one has to give a lot of time, sir, actually. So basically on children. So parents, schools, Anganwadi workers, self-help groups, everyone has to give time, sir.
No, I can understand. I am asking straight question. One is, that is a very good thing, awareness building, everything you have done, council, all these things, structure. But what is the population replacement level in your state?
Sir, ours is actually, sir, we are actually, in fact, number 2 in the country, sir. 2.9 is our total fertility rate.
2.9?
We actually will going to be the number 1 in NFHS 6, sir. So we are basically, we don't actually, sir, we actually only say spacing. We don't, because we don't actually talk about, in fact, we spacing so that there is a better maternal health, as in fact, one of the speaker was mentioning, sir, actually how to really teach those things, to entire.
You give all the details.
Yes, sir.
What is your success story?
Yes.
We are having some success stories. We will work together.
Okay, sir.
Meghalaya government and Andhra Pradesh government can work together.
Thank
I will be very happy.
Thank you so much.
Thank you. Thank you.
Sir, if I remember right, I think in your time, water mission you set up so long back. You brought together 17 departments. I think the idea is very similar, sir. Setting up a human development, this thing, and having that focus. That's important.
That is a good concept. We will work it out.
Sure.
Sir, I want to say something in relation to health, because I have been hearing so many things. So, about 14 years back, we started health centers in addition to our business in memory of my parents. So, we started in all small districts like Srikakulam, Narsipatnam, Gajuwaka, Bhimili, and my village, opposite NTR's village, Nimakuru. So, we are now able to serve every single day 1800 to 2000 poor patients, and in a month 50,000, annually 500,000 people. And this is happening for the past 15 years. What do? We have all diagnostic tests, including x-rays, blood tests, ultrasound. There are about 70 doctors working in all these 10 centers, and they are paid less, retired people. ESI, government doctors. Directly we are able to feed into the mouth of each patient. And Jeevandhara pharmacy giving medicines at 80% discount, cost charging them 20%. So just to give you an example, consultation fee of a doctor is 20 rupees.
Sir, suggestion please, straight, if you don't mind. Sorry. If you can come to the suggestion, what you have.
Yeah, suggestion. So, the solid work is going on, actual solid work at the ground level. I would urge you to depute somebody, look at our Varun medical centers, not anything hi-fi, but the solid work is going on. Lots of poor people are being helped. And lot of people who are sitting here, they all know about it because they have been sending their drivers. And the second thing is, we are running skill development centers, 8 of them. So about 1,000 boys and girls are prepared for denting, painting, air conditioning. So when we have one side unemployment, the other side, there are people are not available with skills. So from that direction, because we employ a lot of people, so we are preparing 1,000 boys and girls. So why don't you have somebody visit our skill development centers and medical centers? People like us, there are so many entrepreneurs. Each district, if you can ask 4 of us to start 5 or 10, your basic problem is solved. You can capture all these typhoids, blood problems at the beginning before they accelerate to a bigger disease.
Thank you.
We are actually doing groundwork.
Thank you.
We'll work it out. We'll ask our people
Know
to
about it, but I
you get all the details. We'll encourage others. In skill development also, we'll send our team to study.
Yes, ma'am.
Congratulations to great Dias. It's not just to sustainable transformation Dias, but it's a Dias to extract the intellectual wisdom and wealth from the next generation. And I'm requesting the great Dias to create virtual and physical governance, research and development, holistic research and development template. Unless we create a just major template, the template, like with reference to deep tech, like the AI template, with that the AI template, we can connect sub AI levels. At the same time, before going to this, all these dynamic structures and template of the governance, which is connected to virtual and physical Dias of the governance, we need to work especially on environment. And always you're telling, sir, I'm a student of you from the beginning. Since my student days as union representative, I know that. So I interacted you. From the beginning, you're also very concerned to environment. So nowadays, in India, what I experienced, I can't walk even a kilometer or half a kilometer on the roads. Because we are not only in just urgency of the work referring to environment, but it's emergency. Unless we work towards environment maintenance and cleaning and just management, we can through, if you initiate, so your Dias is not a just political Dias, it's not a governance Dias, it's a service Dias. And your forum, with intellectual forum, concerned about the government of the people of India through P4 policies, so we can work first through environment issues. Right. So eco-friendly approaches, and you can collaborate. You are the right persons with the help of our national leader, Prime Minister Modi, and you, the great Dias, can collaborate, can initiate, can take all the people, irrespective of any discrimination, industry, people, public, private, all the stakeholders. So Madam, can do wonders. For this, I have a strategy. So I'm requesting you, sir, to initiate environmental program through great Dias.
Thank you.
Thank you, sir.
Thank you so much.
Mr. Senator, we are working in a big way. Swachha Bharat is one. Government of India has created a department itself. Overall comprehensive idea of Swachha Bharat, we are having Swachha Andhra Pradesh. We will take up this issue as a campaign mode. For the last 5 years, if you see in Andhra Pradesh, even garbage is totally, they are unable to lift also. Legacy garbage, nearly 85 lakh metric tons are available in Andhra Pradesh. That is a big challenge for us. Long back we started from waste to energy, waste to compost, everything. Again, we will work on environmental front, how to improve greenery, forests, how to make it clean, everything. All people has to join together. Ultimately, we have to create a legacy on environment. We have to tell proudly, this is what we have achieved. There is a contribution from every individual regarding environment protection, then only it will happen. We will work it out, we will come back with clear-cut milestones and involvement of every citizen in the state. We'll do it.
Thank you, sir. So this is the last question. Last question, please. I know there are a lot of people queuing up for questions. Real apologies. Seems sir's time is very less, and this will be the last question, please.
Good evening, sir. Thank you very much for this wonderful program. So I wanted all of the members to know, I was interacting with 2 startups in the morning, sir. So how we can take them forward. One was RapidX. I would request the suggestion would be to make them involved in all the blood banks. What they are doing, sir, if you take a blood sample, when you take blood out, we only test for hemoglobin. 90% of the women are hemoglobin deficient, sir. But this instrument is telling which type of anemia. They're also testing for malaria, and the beauty is they're testing for cancer screening also, sir. And they're not charging, it's only a monthly charge of 5,000. So if we make it, that startup's name is RapidX, they have deployed, yesterday I spoke to them. If we can mandatory for all the blood banks to have that equipment, the advantage would be, sir, everybody donating blood would be screened for blood cancer also, would be screened for malaria also, and for which type of anemia also. All those things are not happening now. So that we will be the first state in the country where a donor will have access to all these facilities free of cost. That is one suggestion, sir. There's another startup from Nipun Sahani, son of Mr. Ajay Sahani. They were testing for viral infections, and their test was costing only 100 rupees compared to a 2,000 or 3,000 rupees, which took 7 days. They're testing in 10 minutes, and they're requested for doing it in KGH. So if we could facilitate these things, I think the outcome of this conference will be directly available to the public. They will really see for themselves how many people are benefiting this great initiative. The last suggestion I have, sir, you were talking about the data available with all the government institutes, government hospitals. Data is gold nowadays, sir. If we can randomize the data and people who are doing research in AI can actually access this data, if there is a platform where they don't need to run anywhere, it is clearly available that they can access this randomized data without the name of the person. That will fetch a lot of revenue. We can monetize this data to earn gold, sir. So there should be, the suggestion is to create a mechanism where randomized data of all the patients is available for research companies where the government can earn money. And the last suggestion, sir. One last suggestion, sir. The previous government had 17 medical colleges, sir, and you see that infrastructure also is not built. All the medical colleges in Andhra Pradesh, sir, the entire infrastructure is free after 5 p.m., sir. So my request is, instead of starting a new medical college, if we can just appoint new faculty in the evening, we can have double the medical college in every medical college in Andhra Pradesh.
Thank you.
That's the only suggestion I have. Thank you very much, sir.
ఓకే మ్యామ్, వెల్ టేకన్. మీరు చెప్పినట్టన్నీ కూడా ఆల్రెడీ స్టార్ట్ చేశాం. ఈరోజు మార్నింగ్ వాళ్ళు ఇచ్చిన చూశాను నేను, సహాని వాళ్ళు కూడా తయారు చేసింది. ఆల్ యూస్ కేసెస్ విచ్ ఆర్ యూస్ఫుల్ విల్ లాంచ్ ఇమీడియట్లీ. దెన్ విల్ సీ ది రిజల్ట్స్. ఐఎమ్ అష్యూరింగ్ యూ వెరీ సూన్ వీఆర్ గోయింగ్ టు క్రియేట్ ఎ బాడీ ఆల్సో, వన్ కమిటీ టు సెలెక్ట్ ఆల్ దీస్ థింగ్స్. Across the department, single agency will do all these things. That is one. Second one, as you rightly mentioned, all the data, not only monetization for the government. I want to go for startup companies to use this data and create use cases. Again, they can come back. We will use that. Then proof of concept is right with accuracy. We will certify them. Then they can scale it up commercially. That also will encourage. This is where from the morning I am hearing all of you. Detailed way we are going to check out a program. Already we are having clarity. We will improve further. We will put it for public consumption and public utility. Basing on that, once in 3 months, we'll have similar sessions, computation, everything. We'll review continuously till we reach reasonable level.
Right.
That is what I am thinking. We'll work it out.
Thank you, sir.
Anything?
Sir, there are a lot of people waiting, sir, but time is less.
What is that youngster? What is your suggestion? Carry on. Come.
Good evening, sir. Actually, most of the delegates who are most senior leaders and innovators, they got the chance to question. I am a third year student. As a young entrepreneur, I just have a question. Mine is an AI-based startup in software as a service and product. We are making augmented reality smart glasses for blind, deaf and mute, sir. And after seeing your in your assembly where you have spoken, you have shown your ring. So I thought of to get a chance to demonstrate myself here. So I've past 8 months I have been trying in 3 governments, that is Madhya Pradesh, Gujarat and Telangana government, to incubate my own startup, which is not being possible. So with this smart glasses, with the wearable ecosystem, which is being available at low cost, our goal is to give a facility which is being given to the richest person. Same facilities need to be given to the poor. So we are delivering it in a low cost. So
What is the product?
Augmented reality smart glasses for blind, deaf and mute people. So how the Andhra Pradesh government can assist me in incubating my own startup here?
Okay, you be in touch with him, we will work it out, but we will structure it, people like you how to go about. That is where I told you, tomorrow there will be incubation hub in Visakhapatnam itself. You can go straightly. Then they will handhold, they will guide you, they will mentor you, they will launch you, and then they will take to the logical conclusion.
Thank you so much.
We'll work it out.
Sir, one very last question from my side. In your first term in the undivided Andhra Pradesh, you were worried about malarial deaths and you started reviewing the program very hard. And at that time around 10,000 deaths were there roughly. And it started going down very, very rapidly once you started reviewing the program. But then we also saw data which showed deaths due to unknown reasons going up very strongly. It could well be that they were classifying it as unknown because CM Garu is reviewing it. So one last question to you is that are you worried with the way data, tech and AI trends? Which are the worries for you, which is keeping you up in the night? Just the last question, sir.
Follow your question. Can you repeat?
Are you worried about how the data and tech can also be manipulated, can also become a problem rather than only a solution?
No, from the beginning I am telling you very clearly, in computer you feed garbage. Garbage only will come out as outcome. I am very clear on that. So, data scrutiny, corrections, updation, it should be 100% foolproof, then only we will get 100% perfect information. For that, checks and cross-checks, everything we have to follow. Even recently, one example I am giving you, how computers are very dangerous. Land records. Government has wanted to they are saying we are computerizing your records. Then there is a clause 22A. Once if you add 22A, it is government land. If you delete 22A, it is private land. Then what they have done cleverly, they added 22A. Manipulation. Then people will be, automatically that middleman or broker will come, your land you give it to me. If you won't give it to me, then it is 22A, it is government land. Then you face the music. Then that fellow, poor fellow, where he will go? Naturally he is surrendered. Some people have compromised. Throwaway price they have given. Again one word, 22A, they deleted. Then automatically land is valid. Private land. That type of manipulations is very danger in computerization. That is where Government of India, Aadhaar is 100% foolproof. Our digital currency is working very well. 40% transactions globally we are doing. Still, cyber security is a threat.
Sure. Thank you.
I have given digital currency report. At that time, I used to work, I used to call everybody, Reserve Bank, bankers, even service providers, even technology persons, everybody. I used to ask them only one question. What is the security? Is it 100% foolproof? Nobody told me it is 100% foolproof. Always technology, some fraudulent fellow is more efficient than you, is more innovator, then you will break your program. That is the biggest danger. But at the same time, governments, regulatory agencies has to be very clear. We have to control. Data, I am assuring you, what we are going to get 100% foolproof data, nobody can tamper. And also, on the basis of that, I want to take decisions. And checks and balances, passwords, everything, what are all the security, we can keep, everything we will keep.
Wonderful.
You can rely on government data in course of time. We will purify everything, every data, single source of truth. This record is there, it is 100% foolproof, that is our sovereign guarantee. I am telling you, I am assuring you that stage we are going to reach very soon.
Thank you, sir. Thank you very much. CM Garu has spent almost an hour listening. I know some of you are waiting for questions. Our sincere apologies. We will now go into for MOU signing, and then the rest of the speakers will come later after that. So those of you who had questions further, our sincere apologies. We are not able to cover all of them. Sir, thank you very much. A big round of applause to CM Garu for his time.
Now, one question I want to ask all of you, because you are all intellectuals and also technical people, some people are interested in technology, all these things. This type of conferences are useful in course of time. If it is useful, can you raise your hand? Okay, that's good. Yeah, I will make it department-wise and also integrate technologies, everything use cases. Ultimately, data where you are going to get, that is one issue. Either drone or CCTV camera or otherwise your cell phone or your satellite or sensors. That is your innovation. Ultimately, I need use cases in government and public use cases. We will promote all these things. Department-wise, we will have some special sessions where you can exchange with them and then you can provide some services to them. We will work it out. Now, that is again, it is a legacy problem. We are overcoming all legacy. Even I am working one more thing. Tomorrow for all incentives, I want to start escrow account. Immediately, whenever you complete the work, it will come automatically. Nobody can change in future. I am thinking that also, escrow account. I will open. Biotech hub we will keep. Long back I have started that Genome Valley, Hyderabad. Again, I am thinking seriously, here biotechnology. Yeah, we'll make it. One of them, either Anantapur or Uttarandhra, will make it.
Thank you, CM sir. Now quickly, I request Honorable CM sir and CSR to be on the dais. I request Sanjay Gupta ji, our CEO, to be present on the dais. We have 7 MOUs between GFST and different organizations and also with Government of AP. I request all the concerned people to be readily available so that we can finish them quick succession. The first MOU is between GFST and Samagra. I request Mr. Gaurav Goyal, CEO and MD of Samagra, to come on to the dais, please. So these MOUs are basically for project monitoring, institutional support and studies. Now next MOUs are between GFST and GAME, Mr. Ketul Acharya, President, and Mr. Mekin Maheshwari, Founder. I request both of them to be quickly come onto the dais, please. Then next MOU is GFST and German University. Mr. Raj, please. Mr. Raj from German University. Yes. नाम पढ़ने के बाद दे दो. नाम पढ़ने के बाद. उसके बाद next. Doing it, sir. He is talking. German.
ఆర్డర్లో చదవచ్చు. ఏఐజీ జిఓఐపి, దాని తర్వాత సిఎంఎస్ జిఓఐపి.
జిఓఐపి అని ఒకసారి చదువుతాను. నా కంఫర్ట్లో నేను చదువుతున్నాను సార్. గేమ్ అయిపోయింది. గేమ్ GSR, went great. GOAP is there. Be there interactive. So with German University, request Mr. Raj to be on the dais quickly, please. The next MOU will be with between GFST and Fluent Grid. Dr. Murali, please. Next MOU between GFST and GSR, Dr. Srinivas Gosala. Then the next two MOUs are between Government of AP, one is with CMS. I request Lokati Karuna, IAS Commissioner, Health and Family, and from CMS, Mr. Shivkumar, Founder. Entire GFST team and event management team to quickly come for a picture with Honorable Chief Minister. Request all the GFST team. Ramnath Garu, Ramshaura Garu, Raju, quickly come.
You gotta put your past behind you. Look, kid, bad things happen, and you can't do anything about it, right? Wrong. When the world turns its back on you, you turn your back on them. That's not what I was told. And maybe you need a new lesson. Repeat after me. Hakuna Matata. Hakuna Matata. It means no worries.
Thank you very much for spending time with us, sharing your thoughts, perspectives, and also all the sponsors who supported this event. I thank Novotel for the hospitality. We have coffee tea going outside. I request all of you to go and have refreshments and then have a safe journey back home. Thank you very much. We will soon
that takes you higher. I will forever be intertwined with you.
IIT University and
the sun never goes down and time will slow down.
Students also can come and have teachers.
Too crazy to believe. Decided to stay forever. Decided to stay forever.
Please come quickly, students.
Stay